Healthier Together. Sponsored by Regents Blue Cross Blue Shield of Oregon.
June is Men's Health Month, and while men are affected by diseases that can impact anyone, heart disease, stroke, depression, cancer, studies show they also pay less attention to their health than the average woman.
And culturally, men tend to neglect their health. They tend to assume they're fine. They tend to wait until they actually are having a problem rather than taking care of themselves ahead of time.
Dr. James Polo is the Executive Medical Director for Regents Blue Cross Blue Shield of Oregon. He says Men's Health Month is an opportunity not only to educate men about their own health, but to make sure they're taking charge of their health. And that starts with an annual visit to the doctor.
Those annual checkups are really important. First of all, there's some key things, key symptoms that you can develop that will lead to chronic disease that you won't know you have it unless it's checked. For example, blood pressure. If your blood pressure is going up, that's an early symptom of potential cardiac disease. But you won't know it because you can't feel it. High cholesterol. If you have a high cholesterol, you have a greater chance that your arteries are going to get clogged. But you won't feel that either. So unless you have these things checked, you're not going to really know that you might have some early symptoms where treatment can make all the difference.
Those yearly checkups also include cancer screenings for things like colon and prostate cancer, which, if caught early, can be treatable.
And one of the things about cancer these days is that if we can identify it early, more often than not, you can actually cure it. But if you wait and you miss that early diagnosis, sometimes it progresses far enough along that you can't quite cure it anymore.
Studies show, compared to women, men are more likely to drink alcohol and use tobacco and make risky choices. But many of the health risks that men face can be prevented with a healthy lifestyle.
And part of the challenge is that very often people don't maintain the consistency of attending to exercise over time. And so I generally recommend, first of all, about 150 minutes of exercise a week is sufficient. So that's 5 days for 30 minutes. Prioritize it, make it fun.
And a healthy diet, he says, is key. Cutting out fried and processed foods, moderate amounts of red meat, adding poultry and fish, eating whole grains, veggies, and limiting the amount of alcohol you drink on a daily basis. For men, that's no more than 2 drinks a day, if at all.
So it's very important to remember that these lifestyle preventive checks are something that continue throughout your whole life, starting very early as a young adult, well into your older years.
We'll have a Healthier Together segment for you every week on KGW News. Next, we're focusing on LGBTQ+ youth, their unique struggles, and how parents can better understand and talk about their kids' mental health.